Hello, hello. Hi, everybody. I hope this video meets you doing well. Dr. Ude here. I'm a board-certified family medicine physician, for those of you that don't know. Thank you so much for joining me today. The purpose of this video is to give a wellness tip on hemorrhoids. It was a recent question I had from a patient. And so I decided I would pop in here and give a quick informational video on it. So what's a hemorrhoid? Hemorrhoid is an outpouching of a blood vessel underneath the skin in your anal rectal area. And so basically that's where stool comes out from, when you go to the bathroom number 2, that's what we're talking about. Now, most hemorrhoids are painless, okay, but they can get irritated. Depending on how big they are, they can get in the way when you're trying to go to the bathroom number 2. And then eventually they can actually get painful. In some cases, they can get infected, or in some bad situations, you can have a blood clot build there. Now, this video, I'm just going to talk more about just the basic things that can be done to improve symptoms earlier on. Okay. Now, what's the most common reason for hemorrhoids? A lot of times is constipation. So when people are constipated, you have to bear down when you go to the bathroom, and that pushing pressure, if you're doing it all the time, can put pressure on that area and encourage hemorrhoids. Another common reason would be for pregnant patients. Unborn fetus is sitting in the pelvic area on it, and causing vascular congestion, and that can worsen hemorrhoids in the rectal area. Now, what can we do about it? So I mentioned 2 most common things. One of them is improve constipation. So you can eat a high fiber diet, veggies, drink lots of water. You can take an over-the-counter laxative like a Miralax, and it'll help with going to the bathroom. The other one that makes hemorrhoids really uncomfortable is friction. So what I suggest to patients that are having a hard time with this would be when they go to the bathroom, after they've done number 2, if you're home, use the shower head and just spray that area clean, dab dry. Don't use dry tissue paper because that can be irritating. Dab dry and then apply some Vaseline. Vaseline is just petroleum jelly, and usually it doesn't cause any irritation. Also, it minimizes friction when people are walking, so it really, really does help to soothe the area and not cause any irritation. Now, obviously, if you're out and about and you're not home and you're not able to wash, then that's where I would suggest wipes. And then obviously once you've finished wiping, then apply more Vaseline to the area. Not a ton, just a little bit. So these are the few tips. Now, for situations where it's infected, usually you need antibiotics. And that's where your doctor comes in. You go see your doctor to get an antibiotic. The other one is if it's really painful and your doctor deems that there's a concern for a blood clot building underneath, then you may need to see a specialist to have that removed. So I hope this was helpful to you. So if there's any issue with the hemorrhoid, the top things to do is, ensure to prevent constipation the way we talked about. Hydrate, high fiber, and then you can do something like Miralax over the counter. And then also, if you have it, then you want to make sure that you keep that area clean. Try not to irritate it with dry tissue paper, and then wash and dab dry. Okay, and then if it's worse than that and it's not getting better, you need to definitely see your doctor. Now, we are accepting new patients at Apple Valley Family Medicine. We're located at Martinsburg, West Virginia. So if you're around the area, you could come by and see us. Now, we also do virtual appointments, so you can call us 304-350-1087, and you can also find us online. at www.applevalleyfamilymed.com. So I hope this was helpful. I want you to have a wonderful day, and I'll be seeing you next week.